Hello friends, welcome to another video. This video is regarding adductor-related groin pain. ARGP was found to be the most common reason why athletes seek medical help. Also, the diagnosing of groin injuries can be challenging because they have many different causes. It is also important to check for other possible reasons, including issues related to the female reproductive system, stomach and intestine, urinary tract, as well as hernias and joint problems like osteoarthritis. It is important to understand the anatomy to diagnose a groin pain. The main job of the adductor muscle is to pull the thigh towards the body at the hip joint. The adductor longer muscle also helps to turn the thigh outward and bend it forward. The groin strain often occurs in fast sports like football and hockey. They happen when the adductor muscles stretch and contract powerfully while the hip movement outwards and away from the body. Patients feel sudden groin pain during movements like stretching or getting up from the bed, and they often feel pop sounds. Mostly, the dominant leg is more frequently injured. The patients with adductor strains may have weaker muscles when tested, and the squeeze test might be positive. On palpation, there is often tenderness on the adductor complex, and in most of the cases, the imaging is not required. Coming on to the management, in the initial stage, the groin strain is treated with protection, proper loading, ice, compression, and elevation, and of course, use pain meditations if needed. Patient education plays a vital role in groin strain. They have to aware most of the groin strain can be better with light activities, rest, and usually they get better within 1 to 2 weeks. If a patient is not progressing or recovering within a reasonable time frame, it may be worth it to refer to an orthopedic surgeon for further management. In terms of preventive management, first comes hip strengthening. Strengthening especially abductors and gluteal muscles. Strong hip muscles can stabilize the hip joint and prevent overuse injuries. However, warming up habits are extremely important before engaging in a physical activity. Next comes posture correction. Maintaining a correct posture throughout the physical activities can prevent from biomechanical injuries. Next is a case study of one of my patients who was having adductor-related groin pain. She was a marketing professional and she had a persistent right groin pain impacting her running. She used to run daily as a part of her exercises. Because of her sudden onset of pain and Faber's test was positive, she was advised to take an MRI to find if there is any other pathologies. She was having tenderness on the adductor complex and the squeeze test was positive, and she was diagnosed as adductor-related groin pain. Her management was like initially rest and some strengthening exercises of her adductors followed by postural correction. So she developed better results. Discussing about the challenges I faced during this case would be the complexity of the diagnosis. Keeping up with the latest research and techniques in the field helped me to offer the best care for my patients. Next challenge was tailoring a personalized treatment plan. Not all individuals are same, so I have to communicate with each of the patient to tailor their own treatment plan. The next challenge was to ensure patient compliance and to get a best result. By celebrating small victories of the patient, I maintained the patient participation in the exercise. These are references and additional resources if you are interested in further studies, and if you have any questions, please feel free to comment and also think about subscribing to the channel. Thank you. Thanks for watching.